you, Chairman Carter. Would you bow your heads with me? Lord our God, we give thanks on this beautiful first day of summer. We are grateful for the beauty that surrounds us in our beachside community and the joys that we experience with family and friends. And yet we're mindful this day of the murderous violence that was unleashed one short week ago upon our sister city of Orlando. With them, we mourn, and we pray for healing and comfort for the survivors and their families. Bless and strengthen the hospitals and their staff who ministered day and night to those who suffered in this tragedy. And we ask that you, our God, would grant us here at Sarasota Memorial renewed commitment to be vigilant and to be prepared to serve our community, whatever the circumstance. Grant us the competence and the compassion to serve well our neighbors who come to us in need. These things together we pray. Amen.
Join me in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to call the meeting to order for the Sarasota County Public Hospital Board. At this time, any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claim adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. At this time, I'd like to ask for a motion to amend the orders of the day.
I move to amend the orders of the day to add item 9D, approval of the Watchman device criteria.
Do we have a second?
Second.
We have a motion and a second. All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. And now I need a motion to approve the orders of the day as amended.
So move.
Motion and a second. All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Again, thank you. Now we'll have the approval of the minutes of the meeting of May 16th, 2016.
So move.
We have a motion and a second. Unless there are any questions or amendments, we will have the minutes approved as written. And next, we will have board reports. Do we have any board reports today? No? Okay. Our next item is the CME program. And Dr. Hamad, if you would introduce our speaker, please.
It is my pleasure to introduce Dr. Deepak Nair. He comes to us having trained at Albert Einstein and Emory. He is a vascular surgeon with Vascular Associates. Has been with us 9 years and is currently the chairman of the Medical Education Committee here at the hospital.
Thank you for having me here, and I represent our Medical Education Committee, and thanks for allowing us to introduce ourselves and tell us what we do, tell you what we do. You can hear me okay, correct? Yes. Okay, so I'm not just dependent on the mic. So first of all, who are we, right? These are the members who comprise our committee. It's a very multidisciplinary committee. You can see that we have cardiologists, we have podiatry, we have radiology, we have psychiatry, and we also have nursing now. This committee was really born and labored through initially by George Bishoperic and Bob Wyndham, who then gave the reins to Bruce Robinson, and really Terry Levanti as well, who worked very hard on this committee and brought it to where it is today. Mary Pat McNicholas, myself, and the rest of the committee have been running with this for the past year. So we're really lucky to have this committee around, and it's been taken care of well, and we're just sort of moving it along. Having this multidisciplinary committee really lets us decide what's important in terms of medical education. And we don't do things just out of interest. Sometimes we do, but really we do things more out of a mission. We look to other committees at the hospital, risk, QI, when events happen, when physicians call and tell us there's a need, we then do an event. We have different methodologies, as I'll show you, for delivering education at the hospital. What we do, we're most famously known for Grand Rounds. Grand Rounds is a time-old tradition in medicine in which the staff comes together and we provide education. We do this twice a month during season and once a month off-season. Let me run over the topics and tell you how some of these came to be. These are some that we've done and some that we're going to do. We had one about concussions. Actually, we did this talk the Friday that the movie came out. And this was a big need. Came from pediatrics, came from the adult medicine section, saying, you know, what do we do with concussions? How are we diagnosing them? And what do we do about them? Things that we learned at the meeting, including myself, is outside of football, believe it or not, women's basketball is probably number 2 or number 3, things that you don't hear about. I'll give you another example, radiation safety. We were really lucky to have one of our committee members, Ryan Harvey. We looked to him saying, look, radiation safety is a big issue now for patients, getting multiple CAT scans, how do we get their doses correct, and how do we track them, as well as staff who's now involved with more and more radiologic procedures we're doing. Dr. Jack Wazen gave the most recent talk on evaluation and management of the dizzy patient, which is a big topic in internal medicine. Coming up, we're doing a few important things. Carol Ann, who's on the board here, was nice enough to volunteer to talk about documentation. This came out of many young physicians coming right out of training, and believe it or not, nursing, who are in training, who just came out of training saying, we don't know how to document correctly. What they meant was, I think, was legally speaking, or what can we say, what can't we say. We had issues about informed consent, and we all signed the paper, but documenting what we did, documenting the thought process that we encounter when we see patients. So an example of how we get topics and we act on it. We also now open up certain grand rounds to the public. We think it's very important to do. We did cognitive aging, which was a great topic. Bruce Robinson brought that along, and we had a good amount of participation. Our concussion talk was open to the public, and we're now planning one for September when we talk about how healthy is Sarasota County. We're going to work with the public health department and talk about our mortality rates, who's dying, how they're dying, our accident rates, infant mortality, things like that. Trauma grand rounds is something else we support. We give continuing medical education credit. There are certain parameters that you need to accomplish before we give that credit. Things have to be unbiased. There can't be any sort of material support. It can't be funded by industry. So we put these regulations in place for all these different grand rounds and speakers that we bring in. We also do cancer conferences, which is run by Nikki Seiko and Larry Silverman. They look at patient cases and try to plan cancer care multidisciplinarily. We're also doing something that's new, that's afternoon lunch and learn. Mary Pat McNicholas has really taken the lead on this. We're providing different programs during lunchtime with some meals because there are certain parts of our staff that can't come to the morning and evening programs. Journal Club, neuroscience peer review, and what we're just started, which is a new program starting next Tuesday. Cardiology and cardiothoracic surgery have gotten together and are now doing Journal Club, and we're supporting that. Finally, the last new thing we're doing is the evening medical education wellness programs. This was again brought to us from the nursing department as well as some of the physicians talking about the importance of wellness for the medical staff. Peace and Public Health, which Karen Ahmad helped us with in this January, was fantastic, talking about how just having an environment of peace was so important to the health of everybody. We're doing one this Tuesday, which everybody here is invited to. It's talking about bringing your soul to work, thinking of it that way, and having some civility in the workplace. It was put out as a reaction to sort of some bullyism, I guess, I don't know if that's a word, bullying in the hospital, or a perception of bullying, and also brought out because we wanted people to come to work as happy as possible. I don't think it's it's a grand solution, but just making people aware and making it a fun event with food and in the evening with excellent speakers is a way to do it. Finally, the last one is going to be on October 21st, stress management. We've heard a lot of people tell us about the importance of sexual health and being stressed out and then going home and not being able to enjoy that part of their lives. So, it is a problem. So it was brought to us, and we thought we'd do it in more of a fun way, and that would be part of a wellness program. The speaker, we've seen before, I've seen personally before, and after her talk, there's usually a line out the door for a question. It's an OB. I'm blanking on her name. She's down in Palm Beach. Maureen Willihan. Maureen Willihan. She's great. And most of the line is comprised of men, by the way. We also sponsor cardiac conferences, Cardiac Summit, Neuroscience, Pain Symposium, the Breastfeeding Symposium here at Sarasota. So our job is to make sure these conferences are done correctly, done without bias, and support them. Another very important thing for most physicians, license renewal day, to make sure they're in compliant with the state regulations. Yes. Do you have a question? Sorry. License renewal day and CME conferences.
One comment for you and your whole group. I assume by your inclusion of nurses that you're allowing them to be instructors as well?
Absolutely. I mean, instructors in the sense of speakers and teachers.
A lot of people don't have the expertise those guys do, and they need to be listened to more often than they are.
Oh, absolutely. Absolutely. We actually
I appreciate the fact that you do that then.
Thank you.
Congratulations.
Thank you. One of our talks coming up is one of the nurses are going to be giving grand rounds, and that's going to be sort of a seminal event. So that'll be great. And our partners really are the hospital and the foundation. They're the two pillars of really where our committee stands. They do everything for us, whatever we need. We're not a committee that really spends money, to be honest. We don't have many major needs. But I think we do something that's very important. This is sort of how our committee works, what we do for the hospital. And really, the committee is a true committee in the sense that we all pitch in, and not one person does anything more than somebody else.
Thank you.
My pleasure. Thank you for having me.
Thank you, Dr. Nair. Our next item is the Hero Award. David, I'm sorry. What can I say?
Whatever, I'll just answer to yes.
Just
All
don't
right.
call you late for lunch.
It's already been served lunch. You don't get to be called late.
Okay, is Judy up first? So our hero award for May is Judy Schweim. So Judy, can you come join me? Yes, you want to hold hands? Okay. It's the best offer I've had all day, all right?
Probably the best you're going to get.
Yes, sir. So Judy Schweim is our Hero Award winner for May. Judy's an LPN2 and medical short stay and was recently taking a patient from our new departure lounge to meet their ride. Just then, a couple emerged from elevator A, frantically asking for help for a person who they said was passed out in the garage. Judy returned with the couple to the fourth floor of Waldemere parking garage, where a visitor of a patient was in distress. She had barely pulled her car into the spot before opening the door and becoming ill and nearly unconscious in the driver's seat. Judy quickly performed sternal rubs until the woman finally awakened but was barely responsive. She then called 911 from her cell, then called her manager to contact security. She stayed with the patient until EMS arrived and took the patient into the ECC. Thank you, Judy, for your quick response, providing great care. Thank you.
There we go. Hi, Judy. Well, like any Hero Award, we have a plaque here, but that is, just our small recognition. Obviously, the individual that you helped, the reward. The hospital board and administrative staff of Sarasota Memorial Healthcare System hereby inducts Judy Schweim into the Team SMH Hero Hall of Fame for actions that capture the essence of a true hero, including courage, to have the persistence in the face of fear, passion to always do the right thing, integrity to have a strong moral compass, and concern to have concern for the well-being of others, which you obviously did. And it's signed by both the President and CEO, David Varinger, and the Chair of the Sarasota County Public Hospital Board, Greg Carter. Congratulations.
Thank you.
They'd love to hear from you. You can stand up
Thank
here.
you.
All right.
What an honor.
Thank you so much.
Congratulations.
So I need to keep going, Mr. Carter?
Please.
Okay, so Jack Brockman, can you come join me? Jack? Okay, I think Jack's not here today, so we'll do him next month if that's all right.
Okay, that's fine.
Okay,
Thank you, David.
thank you.
Okay, we'll move to the report of the medical staff. Dr. Karen Hamad.
Okay, first, we have a recommendation to approve ARNP/PA prescribing controlled substances as allowed by the state of Florida.
I move approval of the addition of controlled substance prescribing for ARNPs and PAs as allowed by the laws of the state of Florida, subject to the current supervisory standards for allied health professionals and as recommended by the Medical Executive Committee.
We have a motion and a second. Any questions or discussion? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Next, the medical staff requests approval of the emergency medicine department rules.
I move approval of the rules for the Department of Emergency Medicine as adopted by the department and recommended by the Medical Executive Committee.
Do we have a second? Second. Motion and second. Any questions or comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Next, the medical staff requests approval of the obstetrics and gynecology department rules.
I move approval of the rules of the Department of Obstetrics and Gynecology as adopted by the department and recommended by the Medical Executive Committee.
Second.
We have a motion and a second. Discussion. If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Okay, and lastly, the medical staff requests approval of the Watchman device criteria.
I move approval of the Watchman device criteria as approved by the Department of Cardiology and recommended by the Medical Executive Committee.
Motion and a second. Any questions or comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much. And that's all you have?
That's all I have, sir. Thank you.
Okay, thank you. Next is the auxiliary report with the auxiliary president, Ed Miller.
Thank you, Mr. Chairman. Several positive events have taken place during the past month. Our latest vendor sales program, which raises money for our scholarship program, featured an electronics vendor the last time. This entity, which has been featured here before, is another very popular event. These items are a step up in price from some of the other sales items, but the use of payroll deductions allows our shoppers to participate by spreading the cost of their purchases over a maximum of 3 payroll periods. The auxiliary netted over $2,100 from this event. Not a big number to you all, but for us it's a big number. And it was depleted because our treasury was depleted because we awarded 5 scholarships last month. Item 2, with regard to the 7 Courtyard Tower Cardiac Progressive Pilot Project, we had practiced and implemented protocols for our volunteers to support duties assisting the staff, patients, and visitors of this department.
Excuse me.
And now that the summer season is upon us, we see many of our volunteers leaving to return to their up-north homes and to go on vacations. This is a common occurrence, and we try to offset this by offering positions of assistance to local high school teenagers. TAVs is the name we use. This summer, we will have 105 TAVs working for us. They will be working, for example, in the gift shop, the Courtyard Tower Desk, Discharge Center, as well as the Research Center. That concludes my report, Mr. Chairman. Thank you.
Thank you. Next, we have the report from the Sarasota Memorial Healthcare Foundation, and we welcome Jim Seipert.
Thank you very much, and I welcome this opportunity to be here at this meeting and to be able to give you this report today. Art Wood, who is the current chair, would be here, but for the fact that he is up north during the summer, and so as chair-elect, he called me, and I graciously accepted the opportunity.
Very good.
The first thing that I would like to do is talk to you a moment about some of the activities of the foundation that have been going on during this sort of tumultuous time at the foundation. So, first off, let me point out that the foundation this year, this fiscal year, which began October 1, 2015, to date has granted funds and to the hospital in the amount of $1,296,822, which is just under $1.3 million. And included in this amount are certain specific request items that were approved through the grant process, which were $161,000 for the NICU giraffe omni beds for newborn infants that are in danger and that need special attention and care. That, I think, covered the cost of 20 of those omni beds. And apparently the omni beds let them go from day one through their entire stay at the hospital without having the trauma of having to be moved around, et cetera. In addition to that, $120,000 for the mammograms and screening for uninsured and ladies and women of this community who don't have the ability to be able to afford to get those screenings. And one of the things that I was so impressed with is the hospital's program not only includes the mammograms and screenings, but whenever there's a positive result that comes out and some lady needs follow-up care, there is an entire program, backup program, that is headed by either 2 or 3 nurses that guide them through the process of getting insurance, getting coverage, which may be available through the government, and getting them the appropriate treatment for the issues that they may have just learned they have to face. And the last item that I'll point out of this nature is $287,000 that has been given in educational grants for Sarasota Memorial Hospital care employees in random requests that are smaller requests that don't go through the granting process, but are handled by the CEO of the organization. And so it's a much quicker, simpler, easier process, but there is a dollar value limit that's on her ability to do so. The other thing that I want to point out to you that not only are we really thrilled to see, but I'm sure you're going to be very pleased with, is the EPIC annual campaign has raised $80,488 since the beginning of our fiscal year, which is October 1. And that is almost double what it was at this point in time the preceding year. And, you know, I'd like to think it's because of some great publication we sent to them, but that's obviously not the cause. And the real cause is it's how reflective, it's such a reflection of the hospital staff and its employees throughout the hospital, the doctors as well as all the way down to the guys that are emptying baskets that need to be changed every so often, and how proud they are of this hospital. And that speaks volumes to me. So congratulations to Sarasota Memorial Hospital. The rehab pavilion, the foundation's rehabilitation pavilion brochures are now in circulation, and the foundation's major gifts director, Deb Coleman, is in discussions with major donors who are selecting naming opportunities, and that's going very well at this time. In addition to the rehab pavilion brochures, she is also deep in communication with and supporting the finding of new major donors, which is our sole purpose and our real major reason for existence. So we're very pleased with the work that she's doing. We will have 3 new trustees joining the board on October the 1st, 2016, that were approved at the April meeting, and they are Larry Saslaw, James Taylor, and Ariane Dart. And we look forward to having them on the board. We will be, through the summer, looking at other potential board members to bring onto the board. And should you know people that you think would be good trustees for the foundation, don't hesitate to give us recommendations. We have our last board meeting of this year in September. And in the foundation functioning, all of the committees meet in September before that board meeting. So we do still have the opportunity to have new board members come on effective October 1. Current operations at the foundation. The foundation is currently operating under the leadership of a transition committee. And as you all know, I'm sure Alex submitted her resignation after 22 years with the foundation. And trust me, when you've had someone leading an organization for 22 years, it creates sort of a vacuum and a gap when they resign. Her resignation was effective June 1 of this year. But with her assistance and help and goodwill toward the organization, we have been able to work with a transition committee, which is composed of 4 trustees and 2 staff members, and have really dealt with many of the issues. At the same time, and totally unexpectedly, as was the first event, Lisa Intagliati, the foundation's longtime director of events, planning, and coordination, was hired away from the foundation by the Ringling School of Art and Design in April of this year. So we had 2 vacancies occur. On the first vacancy, I'll deal with that a little later here, just slightly down the page. But on the second vacancy from Lisa's being hired by the Ringling School of Art, we have dealt with that by entering an independent contract with Sally Schewel, whom I'm sure everyone around this board and on this board is very familiar with Sally Shule. And she was hired in this independent contractor status for the benefit of giving the new CEO that we hope to have coming in and located and identified toward the end of this year, the opportunity of dealing with major decisions such as hiring directors that will be with the foundation. But we each think Sally Shule would be absolutely perfect with and for the foundation, but that should be the CEO's option and decision when she comes in, or he comes in, whichever it may be. And Sally, in her great professional manner, has been working very closely with Rachel Rich, who worked with Lisa last year at the foundation. Rachel is developing from her leadership and tutoring in the field. Rachel is a 24-year young lady with 24-year-old young lady with lots of talent and skill and energy. And she will be a valuable employee as time goes by at the foundation, we think. And so the things that they are working on, and I would like to give you all a date that you can mark your calendar with, are the Key to the Cure event, which is October 20 of this year, the Corinthian Donor Appreciation event, which is December 1, and Women in Medicine, which is January 27. And even though it's women, and medicine, men are invited. And I have been, and they don't throw any stones at us or give us any unpleasant looks when we're there. So please don't hesitate to come. Let me update you with where we are on the search for a new president for the foundation. A number of search firms that specialize in philanthropic medical fields for presidents and CEOs were vetted by the search group that was formed, or a search committee that was formed at the foundation. We narrowed it down to 2 for interview purposes, and of the 2, we selected Freeman Philanthropic Services, LLC. Excuse me. Gail Freeman is the president of that organization and is very involved in the activities and search and work that they do. Gail has had the recent success in the past of having located the new CEO at Selby Gardens and the new CEO, I think, at Moat Marine. So she is familiar with our community, which we thought was a plus. In addition to getting her vetted and hired in early May, she was back in mid-May interviewing foundation trustees and various other people, including David Verinder, to get a feel for and to essentially understand what it is we're looking for in a new CEO for the foundation. The hospital is moving in leaps and bounds to new levels, and we at the foundation recognize we need to be moving in leaps and bounds at the same time. And so, based on those mid-May interviews, Gail has now actively completed the position description and online advertising copy, all of which were approved by the foundation last week and are now out and in publication. So we hope to have results of some sort beginning very soon. Gail is now sourcing and developing candidates for the position. The projection that we have is that the search committee hopes to have Gail's first list of 8 of the most attractive candidates by mid-August for review with the search committee and interview with the committee. We'll strike that, not an interview with the committee, but she will be here with those 8 people's resumes. We will review them, evaluate them, and select the best 4, and then set up an interview process. We expect and hope that she will have that list to us by mid-August. which was one of her projections, but she followed it with the statement that may be a bit optimistic, but we hope that it's not. If that is the case, we could very well have a new president for the foundation tentatively hired pending their being able to resolve whatever current employer-employee relationship they have and getting an acceptable availability date for the foundation. So, gentlemen and ladies, thank you. I have enjoyed giving this presentation, and I hope it's been informative to each of you.
Well, thank you very much, Jim. Great report. Next is the Secretary's report. Bob Strasser.
Thank you, Chairman Carter. Before I remind the board members of two important meetings in July, I want to go back to June and tell them about the board members are invited to attend a luncheon with employees, and to accommodate all employees, there will be 3 employee, quote, luncheons. One on the 28th of June, one at 4 p.m. and one at 11 p.m. And on the 29th, there is a luncheon at 11 a.m. As far as July, there are 2 important meetings. One is Tuesday, July the 5th, 8 o'clock, the board breakfast, 9 o'clock, Quality Committee, 10 o'clock, Financial Committee, and 11 o'clock, Audit Committee. And the other one is on Monday, the 18th, 11 o'clock, 11 a.m., review of financials, 11:30 to 12, peer review, and 1 to 2:30, the public board meeting. Thank you, Mr. Chairman.
Thank you, Bob. We'll move to the Treasurer's report. Mr. Joseph DiVirgilio.
Thank you, Mr. Chairman. Only one item today, and that's approval of the bad debt and charity care for the month of May, and I propose the following motion. I move approval of bad debt and charity care for the month ending May 31st, 2016 in the amount of $17,420,000.
Second.
We have a motion and a second. Any discussion or questions?
Please.
Yes, Darrell.
Joe, that's remarkably higher than we normally get on a month. What do we attribute that to?
I'm going to kind of
Joe, if I may.
look at Bill over here.
We were basically just had a bit of a backlog that we continually try to work through, and we caught up a lot in this month. Keep in mind that all of that was allowed for from an accounting statement standpoint, so it's really just a timing difference.
Okay, I was just wondering if we saw something in the community we hadn't foreseen.
No. No.
Okay, thank you.
But Darrell, I do want to point out that we're probably running at a rate of about $1 million a month higher than we have in the past, so it's
Yes.
something we'll have to take a look at.
Okay.
We have a motion. Do we have a second?
Second.
Any other questions or comments? Not seeing any. All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you, Joe. Operations report. Our Chief Financial Officer, Bill Wolchin.
Thank you, Mr. Chairman. I have the financial highlights for May 2016. And so we'll start out with the system operating revenue. For the month of May, we had operating revenue of $57,419,000 compared to a budget of $54,400,000. Fiscal year to date, which represents 8 months of activity, actual operating revenue of $474,694,000 compared to a budget of $450,812,000. Looking at the system total expenses for May, actual of $55,464,000 compared to a budget of $54,606,000. Fiscal year to date, again, that's 8 months of activity. Actual total expenses of $458,220,000 compared to a budget of $442,108,000. Looking at the system's operating income for the month of May, $4,638,000, which generated an operating margin of 7.6%, compared to a budget of $2,543,000, budgeted operating margin of 4.4%. Fiscal year to date, operating income of $38,567,000 for an actual operating margin of 7.6%, compared to a budget of $30,661,000 or an operating budget of operating income margin budget of 6.4%. Moving to operating statistics for the hospital, the average daily census, and these statistics are all on a fiscal year-to-date basis. So far this fiscal year, we're running an average daily occupancy of 489 patients compared to a budget of 447 patients. The average length of stay is 4.67. Last year, we were at 4.79. Admissions through 8 months of activity, 21,729 compared to a budget of 18,695. Hospital surgery cases, 14,501 compared to a budget of 13,925. So far through May, we've had births of 2,248 compared to a budget of 2,216. The hospital's outpatient registrations, 292,280 compared to a budget of 296,783. Emergency care center registrations through 8 months, 85,284 compared to a budget of 76,142. And so far this fiscal year, our case mix index for all patients is 1.87, and for Medicare patients, 1.98. Mr. Chairman, that concludes my report unless there's any questions.
Okay, no questions for Bill? Thank you very much, Bill. Next, we have the Chief Operating Officer, Lori Lang.
Good afternoon, Mr. Chairman, members of the board. Typically, I give an overview and update on projects, but today I would like, with your permission, to talk about a project that we've implemented in our perioperative area, really utilizing technology to enhance and improve communication regarding patients in surgery with their loved ones and family members waiting. And the reason that I'd like to do this is it really does demonstrate how we are so patient-centered and reflects our core value of being patient-centered for our patients getting care here. Today I have Karen Benedict, who is the Director of Perioperative Services, and Michelle Tingle, who have been responsible for finding this app that I'm going to be talking about, as well as implementing the pilot. So if you go back to fiscal year 15, the question is, what came first, our surgical volume growth or the need to expand, which gave the need to expand our operating rooms, or did expanding our operating rooms show improved and growth in our surgical volume? But just like the chicken and the egg, it really doesn't matter. The answer is yes to both. So if you look, this is a number for fiscal years comparing our surgical procedures and volume. And you could see in fiscal year 15, which is the green line, we were seeing pretty much month after month growth. But in fiscal year 16, we really had significant growth with a pop-up in March, which to some degree reflects our trauma volume as well as volume in other surgical specialties. Most hospitals typically see about 1 or 2% growth in surgical volume year over year, and to see 10.5% increase in procedures is really simply amazing. We also measure our volume in the ORs by minutes, and you can see that our minutes are up as well, almost 19%. So not only are we doing more procedures, but they are taking longer, which means they typically are more serious procedures or operating cases. So if you remember, in 2015, in February, we came to the board and requested permission to expand our operating room by 2 rooms at a price of $7.5 million. Before this expansion, we had 26 operating rooms on the main campus and 6 in Cape. And after this expansion, which was completed in January 12th of 2016, we added 2 additional ORs for a total of 34. I must add that the $7.5 million also included the renovations to the waiting room on the first floor. And so with change comes change. So to get the square footage that we needed on the floor plan on the second floor for these 2 operating rooms, we needed to take away the waiting room that was adjacent to that space. And the waiting room looked something like this. They were sitting on top of each other, standing room only, not private, but they were around the corner from the surgical suite. So with moving the waiting room down to the first floor, we knew we had both challenges and advantages. So the challenge is that it felt remote from the surgical area for the physician to talk to loved ones and family members. We knew we wanted to continue to have effective communication between those parties. And for the surgeon, it meant multiple steps for the surgeon to go down to talk to family members. But the advantages were pretty significant. We were allowed to create spacious and comfortable seating areas for family members waiting. We had improved privacy. It had beautiful, bright, and natural lighting. There was a cafe kiosk around the corner, so there was availability of coffee and refreshments. And it was in earshot of our grand piano. So the solution that we found was ease, which is an application. So how ease works is that it can be downloaded on your cell phone, and if you don't have a cell phone, hard to believe, we have some that we can loan to you, or it could be done through an iPad. And you register before surgery, either in your doctor's office or pre-admission testing. The app, once downloaded, you are invited to list the number of invitees for contacts that you want information to go to during your perioperative experience. It can be people here, it can be your daughter that's across country, it can be your neighbor. You get to list how many, and it's limitless, of who wants to get communication regarding your surgical experience. When the patient arrives on the day of surgery, we actually scan the code, which allows us to launch this application. And during the surgical procedure, we are able to send updates to all of those that have been identified to receive this information. So this is where I need help. Read it, said, patient safely, soundly asleep. We had a pilot that was started in April, and it included 282 patients, and we've gotten feedback from about 161, and these are our early results. 9.5 out of a scale of 10 said that the ease experience, an ease experience scale of 1 to 10 was a 9.5. 93% said yes, they would recommend this hospital to others based on their experience with ease. 98% strongly recommended that this ease application demonstrated compassion and caring toward family members. 88% said the availability of ease would influence their choice of a hospital for surgery in the future. And 97% strongly agreed that this experience with ease showed a level of commitment and transparency and better communication by the hospital. But sometimes words speak louder than numbers, and here are just a few of the testimonials from family members. Excellent updates, greatly appreciated by the family, appreciated the timely updates. A nurse practitioner stated, while she was on the family waiting side, was stunned at the specificity and timeliness of these updates. First class. Thank you. And then finally, I think this is such an amazing app, love, with a little heart. Next steps is that we're planning on expanding this beyond the 16 surgeons that were in the pilot. We're hoping to onboard at least 2 to 3, if not more, surgeons every week, and then we'll market this to the community. From a time frame standpoint, this is actually a surgeon-driven process. The surgeon needs to opt in, and our long-term goal is to offer this service to every surgical patient that requires it. One of the nice things that we have seen is that for the surgeons that have opted in and their patients are taking advantage of this, other patients in the waiting room, their family members saying, when can I have that? So it's been just a big success, and we're delighted with enhancing this communication to our family members and their loved ones. Are there any questions? Yes, sir. Karen, do you want to answer that? Any other questions? Thank you so much.
Okay. Thank you, Lori. Now we move to committee reports. We'll start with the Quality Committee, Marguerite Malone.
Thank you. The Quality Committee met on June 7th, 2016, and it is a closed committee by state law. So although we work very hard in it, we do not report on it at this meeting. That concludes my Quality Committee report.
Thank you. Mission and Planning Committee, Marguerite.
Well, the Mission and Planning Committee also met on June 7th, 2016. And our first order of business was a discussion around the Pyxis automated medication system. Dr. David Youngst, our Director of Pharmacy, reported on this system, which is a medication system. And the advantages of this system are that they provide medication security and accountability, medication management, workflow efficiency, medication availability, and medication safety. It was almost throughout the hospital, but it did not, up until this time, include the OR and anesthesiology. And so we have a system not totally complete at this time throughout the hospital, and the software is no longer being supported after February 2017. So we need to expand our platform. We need to include the OR and other anesthetizing locations, and that amounts to 48 additional locations which are required. So he proposed a 3-stage plan to upgrade the new Pyxis ES software and hardware platform, and then upgrade the current Pyxis MedStation system house-wide, and install Pyxis anesthesia system in the OR and all other anesthesia locations. And this program, the cost in the technology advancement agreement is $1.25 million, and then in the new anesthesia system is $1.5 million. So at this time, I move approval of the purchase of upgrades and expansion of the Pyxis medication tracking and dispensing system, and the total amount not to exceed $2.75 million, to be funded from the fiscal 2016 and fiscal 2017 capital budgets as recommended by the Mission and Planning Committee.
Second.
We have a motion and a second. Any comments or questions?
Question.
Yes, Darrell.
I don't recall whether the recommendation included electronic connection from the separate standing ER or the urgent care centers. Are they included?
The Pyxis system is within the hospital, isn't it?
In the hospital only.
Hospital only at this time.
Pyxis is used in those external centers. I thought they were linked electronically.
The Northport ERs is connected as well, but not the urgent cares or the
Right.
physician offices.
Right. Thank you, David.
Okay, thank you.
Our next order of business was about the laboratory information system.
Excuse me, we need to take a vote on
We've
that.
got to vote. Sorry about that.
Any other discussion or questions? If not, all those in favor of the motion indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Thank you. Now I'll move on. We talked about the laboratory information system. We got an update by Harold Vore, who's our new Director of Laboratory Services. And we might add, for those that may be listening, that just as we were concluding the first topic on this day, there was a fire alarm in this building, and we all got up and moved into the main building to conclude our meeting. And everybody made that change without any problem. So Harold Vore then was filling us in on information around our investment of $3.5 million, which we had made earlier on a transition from Meditech, which was our original information system, which had been installed in 1987, to SunQuest, which came in December 2015. And so with the new SunQuest laboratory information system, physicians now, about 90%, have electronic access for results, and then only 10% of physicians are still doing paper, fax-based results. So this SunQuest system improved patient safety, efficiency, and then also stage 2 meaningful use was enhanced. Currently, they're below budget on their project. There are some next steps. They're going to upgrade the bedside barcoding system and add external computerized physician order entries, integrate additional physician EMR systems, and then provide the ability to view lab results on mobile devices for non-SCM physicians. So it was a very enlightening report, and clearly the system has worked out well. And that concludes my report, Mr. Chairman.
Thank you. Next is the Governance Effectiveness Committee, and that committee met on June 7th to discuss appointments and reappointments of community members. And Lisa Totten provided the committee with an attendance record of community members, and that was discussed. The next item was the continuation of review and discussion of community representative appointment and reappointment, as the current 2-year appointments are set to expire this October 31st, and the committee needs to determine the current community representatives are to be reappointed, and if so, they should be appointed to new committees based on need or interest if that's necessary. Also, the committee needs to determine if the current vacancy in the Finance Committee needs to be filled now. And after discussion, the committee agreed that they would postpone taking any action on the community members until after the election. Lisa will prepare an updated attendance chart and send to the board, and the committee did not see a need to advertise for additional applicants. Also, under the board officers, the first vice chair position is not filled at this time, and the bylaws do not require this position to be filled, so this can be done when we elect officers, as we normally do in October. And the unanimous consensus of the board was to wait until November to elect new officers. Also, we discussed education opportunities for orientation and board self-evaluation. And there are various means to get education in the board for our new members, and we're talking about webinars, videos, conference videos, and e-learning courses. So we discussed those and some of the ways that we can get continuing education on the board. And our last discussion was about allowing committee meetings, time in committee meetings for discussions and not just reports. So the committee chairs should deliberately not fill the entire hour with reports that allow some time to have discussion, which we all feel is sorely needed to discuss these items. Since we are under the sunshine, and the only time we can discuss this is during an open public meeting. And that concluded the Quality Committee. Governance Committee, I'm sorry. Next is the President's Report. David Verender, President and CEO.
Thank you, Mr. Chairman. Let's start today with our organizational report card for year-to-date through May 2016. We look at our service pillar, our HCAHPS inpatient number, where we have a goal of having 9 out of 11 of the domains at the 50th percentile or better. We are a little bit short of that. We're at 7 out of 11. Coming out of this season has been challenging, but I will tell you, we think that our numbers are on the rise right now. We look at on our outpatient domains. We see that we had a goal this year. This new indicator, a goal of being at 55 out of 58, being at the 50th percentile or better. We had dipped a little bit below that last month. This month we have improved and come back up to the 55 out of 58. In the people turnover, when we were measuring our turnover of part-time and full-time employees that have been hired within the past 12 months, we had a goal of being 34% or lower. We have come in a little bit below that at 33.89%. Have a lot of folks doing a lot of work on that and really making some movement. In the quality pillar, we have our infection prevention, which is our combined overall standardized infection rate. National number being 1.0. We have a goal being less than 0.95. Very happy to report that we have a result of 0.86, so considerably lower than the national average and our goal. Finance pillar, Bill has already talked about that, but we have an operating margin goal of 5.2%, which is our budget for the year, and we're currently projecting a 6.1% margin. In the growth pillar, we have our inpatient growth pillar, which is inclusive of inpatient admits as well as observation outpatients, being 35,300 admissions for the year. We're projecting right now being a good bit north of that at 39,454. And finally, outpatient registrations at 774,000, and we're exceeding that as well at 752,000. When we look at our HCAHPS report card, we see our challenged areas are continue to be responsiveness of hospital staff, communication with doctors, cleanliness of hospital environment, and the quietness of the hospital. We have teams working on all of these, and we continue to see some good results into that coming outside of this season that we're just finished up. On the outpatient side, you can see we have all of our outpatient service lines, with the exception of ambulatory surgery, hitting 100% of our quality metrics. Ambulatory surgery has improved and gotten to 3 out of 6 with a good bit of work still going on in that department. Next we're going to look into our people. We had last month we had our former NFL quarterback in 2007 Heisman Trophy winner Tim Tebow had an opportunity to discuss concussion management with our concussion research team and local school officials. The former Florida Gator heard about our innovative program piloted by SMH's Clinical Research Center to assess football players at Sarasota County high schools. And you can see a couple of pictures there. I do want to point out to the picture on your right. This was Peter Taylor's younger son. So Tim did take selfies and do Snapchats with all the kids, which I don't think you get the smiles off their faces for quite a while. We also sponsored a local cancer event on June 5th. We've marked an opportunity to celebrate the music of life for over 200 area cancer survivors, and their guest, entertainer Yaya Diamond, donated her time to the event. So just several pictures there for you. We also, every year, Ed, thank you for your organization being involved in this every year, have the opportunity to award college scholarships to area seniors. So Sarasota Memorial Hospital's Auxiliary Volunteer Organization awarded the 2016 G. Duncan Finley Health Career Scholarship this month to 5 outstanding high school students who plan to pursue careers in healthcare. Each student will receive $10,000 to help offset the cost of college tuition and expenses over the 4 years. The auxiliary has funded the scholarships annually for more than 2 decades from fundraising efforts throughout the year. Scholarships are awarded to the students after a detailed written application and interview process in which they demonstrate a commitment to pursue a career in the medical field, strong academic performance, and economic need. So Ed, please thank your whole area for that. We appreciate it. Staying in the people section, this past May 17th, Sarasota Memorial Hospital and the SMH Public Safety Department hosted the 2016 Sarasota County Law Enforcement Memorial Service. This service honored and remembered all law enforcement officers across the nation who gave their lives in the line of duty during 2015. 2 Florida law enforcement officers and 3 Florida police canines were specifically honored at our service. Mr. Greg Carter, our chair of the Public Hospital Board, was our keynote speaker, and thank you very much, Mr. Carter, for taking time to do that.
It was an honor and a privilege. I'm glad I got to do that.
So as it's going into the quality section, as Florida temps begin to soar, SMH hosted a hot car safety demonstration to raise awareness in leaving children and pets in their car, even for a short period of time, can have a dangerous and even lethal consequences. Joining in the effort were Suncoast Safe Kids collaboration led by Johns Hopkins All Children's Hospital, Sarasota Police Department, Sarasota County Fire Department, Sarasota County Health Department, and the Sarasota County Sheriff's Office. The 20-minute demo featured SMH staffer Sean Halls, who volunteered to provide live commentary from inside the vehicle as the temperatures arose, while pediatric and medical medicine physician John Ruffin and community partners offered advice about the danger of heat stroke and ways to prevent it. Just a little side note there. We learned as it got so hot in there, Sean's iPhone stopped. It overheated, so we just tap on the window, make sure he was still responsive after a while. But be sure to say something to him about that. So, staying in quality, earlier in June, certified health coaches from Health Connection had led the opportunity to spend time with kids ages 5 through 12 at the Robert L. Taylor Summer Kids Camp to teach about nutrition and exercise. They focused on My Plate recommendations in the different food groups, eating lots of fruits and vegetables, choosing healthier snacks over sugary snacks, and choosing water over other beverages. In addition to learning about what to eat to stay healthy, they also incorporated fun games such as red light, green light, using healthy foods and unhealthy foods as the lights. Hurricane season began June 1st, and SMH conducts our preparations drill. On May 18th, SMH leaders participated in the state hurricane exercise to ensure our facilities are ready in the event of a hurricane. The group discussed hurricane staffing, supplies, bed needs, and contingency plans for backup power if Sarasota is in the path of a severe storm. The Northport Emergency Room also conducted its own drill. Our Excel program this year celebrated its 30th anniversary, and so former Sarasota County Public Hospital Board member Jim Tollerton had established the Excel Award program to recognize outstanding SMH employees. He continues to fund the program through the Sarasota Memorial Healthcare Foundation. Since its inception, the program has honored over 360 employees as well as exceptional physicians and leaders. Mr. Tollerton recently joined Sarasota Memorial in celebrating the program's 30th anniversary with the current and past Excel Award winners. So just a special thanks to Jim for everything he does. And I don't have it written down here, but I believe we counted out of those 360, 171 of those employees are still here in the system, which is a remarkable retention, considering a number of them have retired. On Monday, June 13th, our growth section, and on Monday, June 13th, Sarasota Memorial announced plans to build a new pediatric specialty outpatient care clinic on the second floor of the Sarasota Emergency Room and Healthcare Center in Northport. The new center is expected to open in the first quarter of 2017. Sarasota Memorial and Johns Hopkins All Children's Hospital, along with Northport Mayor Jacqueline Moore, believe this collaboration will bring new and positive outcomes, new possibilities for treatment options, and a high standard of quality care to the children of the Northport community. The newly constructed center will give Johns Hopkins All Children's Hospital optimal space to expand care for children while also enhancing the commitment of Sarasota Memorial to the Northport community and fostering recruitment of other physicians needed in this medically underserved area. Rose breastfeeding, the first Rose, which is Reaching Our Sisters Everywhere breastfeeding training course, was recently held at SMH. Providing the course is part of a strategy to address breastfeeding disparities in our community and is funded through a grant awarded to the Florida Department of Health, Sarasota County by the National Association of County and City Health Officials for reducing disparities in breastfeeding through peer and professional support project in Sarasota. The mothers who attended the two-day course will now have been trained as breastfeeding peer counselors and will be a source of knowledge and support for breastfeeding. It's a grassroots effort to provide sources of breastfeeding knowledge in the communities where the disparities are the greatest. So thank you very much to Dr. Washington Hill, who's a longstanding member of our medical staff, for leading this, as well as the mayor, who you see there on the left-hand side. Looking at just wanted to give you a couple pictures of our rehab pavilion construction project. Is going up very quickly. I would invite anyone to just drive by it down Arlington and take a look. It's beginning to take form, and I think they have one more floor to put on before they start enclosing. But it's really pretty remarkable if you go out and watch the construction go on. And then, as you might imagine, we've now updated our campus model that's down by the D elevators on the first floor to represent the new rehab pavilion. So please feel free to take a moment and go by. And if there's no other questions, that's my report, Mr. Chairman.
Thank you, David. Appreciate it.
Thanks.
Do we have any items on consent agenda today? I don't think we do. Public comments, Karen? No. Okay. Carol Ann, legal matters.
No report.
Any other business to discuss? Not seeing any, then we are adjourned. Thank you very much.